Clozapine is the topic for this video, and Clozapine, as many of you know, is an atypical antipsychotic drug, and it's used in the treatment of psychiatric disorders such as schizophrenia, and most commonly, and it can also be used for bipolar disorder. And Clozapine on licensing exams is commonly tested with regard to psychiatric medical conditions, but one of the key aspects of this drug is its side effect, or one of the side effects, and that side effect is very commonly tested, and I'll write it out for you. Big long word, agranulocytosis. That's the side effect. It doesn't occur very often, but licensing exams in Canada and the United States, every single one, in fact, that I've ever taken have tested this. So it's a very high yield topic. So before I get into agranulocytosis, I think it's important to explain what does that actually mean. And I think that's best explained by breaking down the components of blood, because agranulocytosis is referring to a certain specific blood cell. So first, when you break down blood, you have the formed elements, which are the cells, and then you have the plasma. And the plasma is, the water, electrolytes, proteins, things like that. But we're interested in the cells, so I'm going to make that part big. So the three types of cells: red blood cells, white blood cells, and platelets. And the white blood cells are really what we're concerned with. White blood cells, there's two main types. There's granular, and then there's agranular. And the granular ones are the ones that we are actually interested in. There's neutrophils, eosinophils, and basophils. I'll write out the words actually. Neutrophils, eosinophils, and basophils. And the agranular section involves two types. There's monocytes and lymphocytes. So, what we're concerned with is this branch here, right here, agranulocytosis. First, let's just look at this part. Granulocytosis is referring to an increase in granulocytes. So it would be these cells increased. When you put A in front of it, it means the opposite. So, like, it's just the way medical terminology is. For example, the term asplenia means you don't have a spleen. So that's what the A means. In this case, agranulocytosis is referring to a decrease in white blood cells, and in particular, the class of white blood cells known as neutrophils. So these ones right here. Now, so you might say, well, why is that important? It's such an obscure thing. Why would it be tested? And the reason is because white blood cells are very much involved, as most of you know, in fighting infection. Infection-fighting cells. So when you have a decrease in these white blood cells, the patient is at very high risk of serious infection due to their suppressed immune system. So that's the reason why this side effect is so important. So let's show a couple clinical vignettes that will take you through this type of scenario. A 35-year-old male with a history of chronic paranoid schizophrenia is brought to his psychiatrist after failing courses of treatment with both haloperidol and olanzapine. His psychiatrist would like to start him on Clozapine. Which of the following parameters should the psychiatrist monitor carefully? Well, the question is easy once you've just finished the explanation. As we talked about in this diagram, the side effect is agranulocytosis, which essentially means a decrease in white blood cells, and in particular the neutrophils. So this is detected on a lab test called a CBC, which is known as a complete blood count. The complete blood count will show you how many white blood cells, red blood cells, platelets, and all the components of the white blood cells, which include the neutrophils. And I don't even think CBC is part of the answer choices, but white blood cells is, so they made it really straightforward for you. Next question. A 32-year-old man with schizophrenia is brought to the hospital by his sister because he has become incoherent and locks himself in his room for days at a time. His family is concerned because he has tried many antipsychotic agents and none of them seem to have worked. During the exam, the patient stares at the wall and cannot seem to find the words to respond to questions. Physical exam is normal. He is placed on Clozapine and scheduled for a visit to the clinic in 1 week. 1 week later, he arrives at the clinic for his appointment. Which of the following is the most appropriate test at this time? Well, again, same kind of scenario. You would do a CBC, and that would show you the white blood cell count and should also show you the neutrophil count. And it would be important to monitor this because in a small percentage of people who are taking Clozapine, they can develop the side effect known as agranulocytosis, which refers to a decreased or lowered white blood cell count, and in particular a class of white blood cells known as neutrophils. So the answer here would be CBC.